Good afternoon, or almost evening. My name is Ashish John. I'm a professor of health service policy and practice and the dean of the School of Public Health. I am very excited about this event, this evening, this year. It is the 10th anniversary of the founding of the School of Public Health at Brown University. Now, there is a very good article in the Brown Daily Herald that I encourage you to read about the history of public health at Brown. And I'm going to start by reading that we could be celebrating the 107th anniversary of public health. Now, that'd be a weird year to celebrate, but 107 years ago, in 1916, the corporation, back then, had the vision of creating the first program in public health. They said because through training in the prevention of disease and the administration of modern agencies for conserving and promoting the health of the community, we wanted to have a public health program. That was 107 years ago. But the point is that while the school is 10 years old as an independent school, public health at Brown has a long and very, very proud tradition that well predates the school, and you're going to get to see some of that. We are going to have a relatively short program, which I am very excited about. But the bottom line is that there has been extraordinary work happening at the university, first within the Department of Community Medicine, in the School of Medicine, and then as an independent school over the last 10 years. Over the next half hour or so as we do this program, we're going to highlight some of the key people who've been fundamentally involved. You'll hear from some of our key faculty in a couple of short videos that we have. But before I go further, I do want to just take 10 seconds to say there may be no one who deserves more gratitude for the work she did in launching this school than Fox Weddle, the inaugural dean of the School of Public Health. There's another person, President Paxson, who had something to do with it as well, but we'll get a chance to chat about that in a few minutes. So we'll do that. But there really have been extraordinary leadership across the university and across the school over the last 10 years. Obviously, Dean Weddle, Dean Marcus, Dean Ron Aubert, who filled in on short notice when I decided to play hooky for a year and a half and leave Brown, but delighted to be back. And then at the university, you'll hear from President Paxson, but both Rick Locke as previous provost, the incredible support we've gotten from Frank Doyle, our current new provost, and then certainly the chancellor of the university, Sam Menkoff. So it has been through all of their efforts, really, that we are where we are. Over the next 25, 30 minutes, you'll get a sense of both the depth and breadth of the school. We have 2 videos. We'll have a discussion between me and President Paxson. And a lot to cover. But before I go much further, I actually want to bring up our first speaker of the evening, the 76th governor of the great state of Rhode Island, Dan McKee, Governor McKee. As you come up, I just want to say a couple of quick words about Governor McKee. Look, my first conversations with the governor were in December of 2020 and January of 2021. And if you remember, those were some of the hardest and darkest days of the pandemic. We had literally 4,000 Americans dying every day, hundreds of Rhode Islanders. We had a vaccine rollout that needed substantial work. And the reality is that Rhode Island was falling behind. The governor made getting people vaccinated and saving lives his top priority when he came in. And I would say within a month or so, we were in the top 3 and maybe even in the top 1 nationally. And that doesn't happen by random chance. It happens through dedicated and hard work and leadership. One more just quick thing, and then I'll turn it over to the governor. When I was in Washington, there were many times inside the White House we would hatch plans of something innovative we wanted to do. And then we would say, this is something that the federal government can't do. We really need a state partner. Who do we turn to? And the governor was unfortunately on the receiving end of many of those phone calls where I'd say, Governor, we have an idea. And he'd be like, oh God, what do you want us to do now? But he was always a good sport. We did some pretty innovative and fun things, and I think actually made a real difference in people's lives. So Governor, thank you for always being a really good partner for us. Governor Dan McKee.
Well, Yeah, Doctor, you've been the partner, too, that the country needed, the state needed at the right time, and so thank you for that. I do recall being at the university club, and the doctor was speaking, and he made a comment that really resonated with me, and I think it's really appropriate as we celebrate your 10th anniversary here today. Someone asked the question, and I don't know if you recall, but you gave a good answer, when are we going back to normal? This was right at the time that we were still struggling to determine, safety and opening the economy and all the things that, we were challenged with. And Dr. Jha said, when you go through a world event, you never go back to where you were. And I thought about that. And we can intentionally go to a really great place and really forward thinking, or a state of Rhode Island could say, oh my God, that was such a terrible event, we're just never going to recover. But what's happened is we have recovered, and we have momentum in the state. And to be here today to celebrate with your leadership and talking with people who, were right on the front lines with the idea. You plant a seed, it grows. So those who were, originally involved with establishing this school, this should be a very proud moment for you tonight. So congratulations to each and every one that, had the vision. And then to carry it forward with President Paxson, I'm very fortunate to be able to meet with the President on key issues that we've set in the state of Rhode Island. And being, very, very simple. We want to raise academic outcomes for our young people in the state. We want to raise incomes for the people and the families that live in the state of Rhode Island. And the third one, which one of the reasons that I really wanted to be here today, we really need to raise health and fitness levels in the state of Rhode Island as well. And that's why, I'm so proud of what the work that you've done. And I know that Brown is filled with leaders and the plans that have already happened, but also the plans that are going to happen. I do want to acknowledge the Brown School of Public Health researcher, Brandon Marshall. I got to meet Brandon. I think Brandon might still be here. I'm not sure if he's here or not. So I was involved in a fundraiser a few years back. And, I'm not sure why anybody would bid on it, but they had dinner with my wife, Susan, and I paid for the dinner. And it was just a coincidence that Brandon came at the time with one of your top doctors that, here at the school. And then I heard that he was involved with opioid issues and being a real leader on that. But I think that's consistent with the leadership that is here at Brown University. So thank you. I know Brown University shares the goals that we've set in the state of Rhode Island. I'm really looking forward to working with not only the school here of medicine, but also the university at large and all the people who want to see really good things happen in the state of Rhode Island. I'm looking forward to continue working with President Paxson and the dean and all of you to ensure the best outcomes for the people of the state of Rhode Island. Thank you for the first 10 years, and look forward to the next 10 years and see what happens. And I'd like to just share with you a special recognition, Doctor, if you take this on behalf of the School of Public Health. I get to sign on behalf of the people of the state of Rhode Island when I give out a proclamation like this. So understand that all the people in the state of Rhode Island are backing this proclamation tonight, and personally I get to sign it. In recognition of Brown University's School of Public Health 10th anniversary, and gratitude for your mission towards improving the health of all populations, especially those most vulnerable, by producing world-class public health scholarships, forging strong community partnerships, and educating the next generation of diverse public health leaders. Congratulations and good luck to you, and we'll stand right side by side with you, Doctor, as we have been. Thank you.
Governor, thank you, and was not expecting this, so this is quite a delight and wonderful. Thank you. All right, so I promised videos. We've got two of them. They're both pretty short. They're both pretty good. I saw them. When I think about the school and what it has done in the last 10 years, as I have said, it is really clear to me that so much of the progress has been built on collaboration with people of Rhode Island, collaboration with community-based organizations, collaboration with our leaders. And it is a very proud tradition that goes well beyond 10 years. And I think our first video, which I'm hoping will get queued up now, begins to help us see that journey. So let's take a look.
Brown is a truly special place. I've always known that it's been famous for having a spirit of interdisciplinary collaboration, but since coming to Brown, it's really true. It's in the DNA of this university and certainly in the DNA of the School of Public Health.
What happened was between gerontology, alcohol and addictions, statistics, international health, these broad initiatives work together to forge new processes for the university in order to become leaders in the field in these emerging areas.
People from different disciplines work together as a matter of practice, and they roll up their sleeve to tackle hard problems.
We have all of these tools, we have all of this expertise, we have all of this knowledge. How can we leverage these resources to work on a problem that's meaningful for you?
We are probably the go-to place in the world for behavioral science around addictive disorders. And what we've done over the past 10 years is brought that to the forefront. And the School of Public Health, I think, has allowed us to do that.
We study, quote unquote, the study of aging, which is gerontology, and how that translates into understanding people's lives as they move forward. But the real issue is what it means for the delivery of care to those people and their care partners and their families.
For a long time, Alcoholics Anonymous was totally against harm reduction. Abstinence was the only way. And my work and the work that we do at the Center for Alcohol and Addiction Studies, a treatment that teaches harm reduction skills has emerged as the treatment of choice in these clinical trials. So to get these individuals to reduce in a harm reduction sort of way makes the most sense, both clinically and empirically. We know that it works much better than trying to get kids to abstain.
We were working with one of our colleagues, a nursing home company, and they transferred their entire electronic medical record to us every night. And then my research team met with their clinical people to try to work with them about what their problems were and what they needed to know to best solve their problems in the field. That is really some of the greatest sort of applied health services research that's been done, to my knowledge, and it's one of the things that I was most proud of being involved with in the 40 years I've been here at Brown.
People like to talk about COVID as being a once-in-a-century health crisis, but it's not actually true. The reality is all the data that we have suggests that pandemic threats are going to continue to happen. They're going to happen more and more frequently. It's critical that people have access to the right information. And in this world, it's increasingly hard to find the right information. So we take very seriously our roles as sort of trusted, independent source of data and facts. That's why the Pandemic Center was created, and that's what we're going to work on doing.
We're ready to embrace the changes that are coming about, where we need to be able to integrate clinical medicine sciences with public health and epidemiological and health services.
All of my approaches until I got to Brown were, you're not a community organizer, you're a scientist, or you are a community organizer and you're not a scientist and you need to find somewhere else to go. So this was the first place where I felt like I could dream and I can implement and it could be considered valuable.
Just gives you a little bit of a flavor for both the breadth and depth of the work. And when I think about the accomplishments of this school, and I know you see Peter, Monty, and the Center for Alcohol and Addiction Studies, it is hard to overstate the impact of getting the world to shift from thinking about abstinence as the only solution to thinking about harm reduction as a really important public health strategy. Much of that was done here under Peter's leadership with a whole lot of scholars working on it. So there's just example after example of how the School of Public Health has really not just produced great scholarship, but actually changed the way we do things in public health. All right, let me quickly introduce our next speaker, who's going to come up and introduce the conversation. Sam Menkoff is the 21st Chancellor of Brown University. For those of you who don't know what a chancellor is, it's somebody who's the head of the corporation, the oversight board of the university, a graduate of Brown, anthropology major, I believe, founding partner of Madison Dearborn Partners, and has been long involved, well before he became chancellor, with the leadership on the board of trustees as a fellow as well. And what's been really remarkable to me in my 3 years here at Brown is watching what many of us sort of think of as a dynamic duo of the president and the chancellor. I don't know if the university has ever had such a strong partnership and two leaders who are as committed to the growth and innovation of a university as President Paxson and Chancellor Menkoff. So ask Chancellor Menkoff to come up and just say a few words.
All right, well, thank you, Ashish, and good evening, ladies and gentlemen. A very, very warm welcome to all. It's great to see such a strong turnout for what promises to be an evening to remember. And special thanks to Governor McKee for being with us tonight and for kicking things off. Tonight we celebrate the 10th anniversary of Brown School of Public Health. In its first decade, under the leadership of 4 superb deans, all of whom are here this evening, inaugural Dean Fox Weddle, Dean Bess Marcus, Dean Ja, of course, and interim Dean Ron O'Bear, who kept the school moving forward while Dean Ja was at the White House serving the nation. The school has gained an international reputation for excellence in teaching, groundbreaking research, and for educating future public health leaders to serve our state, our nation, and the world. Tonight I have the honor of introducing a conversation between 2 great Brown leaders. Dean Ja is leading the School of Public Health vigorously forward with intelligence, character, and an unwavering commitment to elevating its standing and value to the world. And who will ever forget how he stepped up with empathy and honesty amid all the fear and confusion of the COVID pandemic to explain things in plain English to a public thirsting for answers and to become one of the most trusted voices of that dark period. President Paxson is now in her 12th year leading Brown, and it's hard to believe just how far we've come and how much has been achieved on Chris's watch. In fact, it was under her leadership 10 years ago that the School of Public Health was founded. Chris's impact on Brown has been sweeping and profound. She's leading the university with vision, purpose, and unshakable values, setting a standard for excellence in all that Brown does. And through her, we are enjoying not only the fruits and aspirations of a great presidency, but the fruits and aspirations of a great university. So if this isn't an all-star cast, I don't know what is. We're in for a treat. So without further delay, please join me in welcoming President Paxson and Dean Ja.
All right. Thank you for doing this, Chris.
You're welcome.
So, as we heard, 10th anniversary of the school, 12th year as president. If you do the math, you were here when the school started. And you weren't just here, but really centrally involved. So I gotta ask, why create a school of public health when it was thriving within the Department of Community Medicine at the medical school? What was your hopes and aspirations for having an independent school that maybe could do even more than what it was already doing?
Right. Thank you, Ashish, and it's great to have this unmoderated conversation with you. We talk all the time. This isn't hard, okay? Just so you all know. Actually, from my point of view, deciding to form a school of public health was not a hard decision. And the decision was easy because of all the work that went into developing the plans for the School of Public Health that started well before I came to Brown. And I'm looking at Fox Weddle here, many other people who really, I think, understood the importance of having an independent school. Not that there was anything wrong with being part of the medical school, but we know that, for accreditation reasons, for visibility reasons, attracting the best faculty, the students, the independence and sort of on the same level, School of Public Health Medicine, that was just going to be a much better model for Brown. Now, I did public health research before I came here as an economist. Princeton had no School of Public Health, so I didn't have the pleasure of being in one. But I love the field. I think it's so important. And, we can talk more about why it's so right for Brown, but I just want to say the plans were there. The plans were great. So what I needed to do, my job, was to take it to the faculty. I don't remember the meeting. I don't think anybody objected. And then I had to take it to the corporation. Sam Menkoff was there. I don't think anybody objected. And in fact, we're all very happy that we did it.
Going to the faculty and no one objecting seems like an unusual event. So
I know.
They always find a reason to object. So I am going to ask you the question that you sort of alluded to, which is, there are lots of schools of public health. What do you think, I have my thoughts on this, but I'd love yours. What do you think is different about a school of public health at Brown compared to a school of public health at any other university?
Any other place. So the thing I think is really interesting, there are two things, but they're actually connected together. One is that our School of Public Health is engaged in teaching undergraduates, graduates, master's students, and PhD students. So it's not a siloed professional school. In some universities, as you know.
I do know.
The School of Public Health is sort of over there. And if you asked a typical undergraduate where it is, they would have no idea that it even existed. So it's integrated into the campus in a way that is very distinctive. And then the second thing, and we alluded to this in the video, and then you can give your answer to your own question, is that the interdisciplinary nature of Brown and the fact that so many of the faculty who are here, they're working with people in sociology, in the Institute of Brown for Environment and Society, in economics, in medicine, and it's not siloed. And that means that we can have very innovative takes on really pressing health challenges that other universities maybe have a harder time. How would you answer your question?
No, I think that's exactly right. And I, having spent most of my career at another university, and a great university, but the truth is that everybody talks about being multidisciplinary, interdisciplinary. In most places, it's extremely hard. It's hard by the organizational structure, by the culture. It is woven into the DNA of this place. It has been remarkable to me, the number of our faculty, we go to hire someone, and they're going to be jointly appointed between the School of Public Health and IBIS. That is just, IBIS being the Institute for Brown and Environment and Society. Those kinds of things are extraordinarily hard in most universities. They are second nature here. So the reason why that ends up being really important, and the pandemic totally showed this, right, is if you think about the big pressing problems of public health, they are not going to be solved by people who work inside the classic structure of public health. They are going to require people working across disciplines, with economics, sociology, human behavior, psychology, et cetera. We do that effortlessly. I think that is very, very hard elsewhere. That was one of the major things that really attracted me to the idea of taking this great school of public health and thinking about what else could we be doing with it, how do we take it to the next level. And it isn't just talk, it's really a part of the DNA of this place.
So let me ask you another question. I think this ties into what we're talking about, which is, it was interesting to think that I hadn't realized that the corporation voted to establish a program in public health in, I guess it was 1916, which was 2 years before the pandemic. It wasn't motivated by the early pandemic, but it was very prescient in a way. And so we want to deal with the ever-present public health issues, but they emerge in new forms and in new ways over time. The work on climate change and public health, misinformation, disinformation. How do you see staying agile enough to make sure that, the School of Public Health is doing the kind of really basic research that needs to happen, but still moving into these very important new areas in a very agile way?
Yeah, it's a very good question. And obviously, we've got to be grounded in some fundamental things. So we are always going to have a Department of Epidemiology and Biostatistics, and because those are fundamental and they are absolutely important. I think what I think about is the strategy's got to have a couple of elements to it. One is there are emerging things. They emerge over time. So the issue of climate change as probably the biggest public health threat over the next decade, next century, has been emerging over the last 10, 15 years. It's been clear. And we are small enough that we can say we are going to pivot our growth, a chunk of our growth, not all of it, into those areas. So part of strategy is leaving a little bit of flexibility built in so that as new topics emerge, we can shift to those. The challenge always is you don't want to go chase after whatever's kind of hot right now, because universities, that's not the job of universities. We want to be thinking long term. But as issues emerge as clearly big challenges that are going to be with us for a long time. So the issue of information and how we understand truth, how we understand evidence, how the world understands kind of the information ecosystem we live in, I just don't see that as like a flash in the pan issue and it'll be all solved in the next 2 years. It's going to be with us probably forever. That is a great area for the university to invest and to really take a leadership role.
So tell us where the growth is going to be in the next 10 years.
Well, I think we've talked about a couple of those. I mean, I certainly think climate is going to be one. We've talked about information. There's another element which is related to information, but I think when I look around schools of public health and think, who is starting to really work on how AI is going to change the practice of public health? No one yet. And that's a place where we have, I think, real opportunity. There's a lot of good scholarship happening in AI, don't get me wrong, including Brown, which I think is really moving. But AI is going to change the practice of public health in ways that we have not really thought about. That is an area where we need to begin to invest. We need to start understanding it. We need to start teaching our students about it. So I think that is one. And then the threats like pandemics, I mean, Jennifer said this in the video, people see this as like a once in 100-year event. We are moving into an age where we are going to see a lot more novel outbreaks, regional, global. That is an area where we just have to make our country and our world much better prepared and much more ready to respond.
Mm-hmm. Thank you. So another question that I have for you, and then you can ask me any questions you want, but health equity. I did a lot of work in my career over on looking at sort of health disparities, health equity issues, and you've started this program called the Health Equity Scholars. I know some of them are here. Can you raise your hand if you're a health equity scholar? But, I think it's such a fabulous, inspiring program. So tell us a little bit about it and where you think it's going.
Yeah. So I want to start just with the motivation behind it. Right? So early in the pandemic, we saw these very large disparate outcomes in terms of who was being infected, who was getting really sick, who was dying from the virus. And what we saw were that communities of color were very disproportionately impacted. And then I saw the response. And the response was totally inadequate. And I knew a lot of the people leading the responses, like people who were commissioners of health. These were like my friends. And these are well-intentioned people. And it really got me thinking, like, why do we keep getting this stuff wrong? Why do we keep missing the target on issues of equity when the crisis hits? And fundamentally, I believe we miss it because we don't have the right people around the table where the decisions are being made. That while the public health workforce is quite diverse, the leadership of public health does not really reflect the lived experiences of people across America. It certainly does not adequately capture the experiences of people who are more marginalized. And so the goal was Brown needs to be part of that solution, and we have got to create a structural intervention into the public health leadership of America. So the Health Equity Scholars Program, which we launched in our first year after I came, the idea is it isn't just about training great scholars in public health, it is that, but it is about building a network. Because when I think about how do people get into those decision-making places, just a few weeks ago, a friend of mine who's a health commissioner of a state called me and she said, I need an epidemiologist to run our state epidemiology program. And I kind of thought about it on the phone, and I gave her like 3 names. And so she reached out to them. And I thought, this is actually how a lot of stuff happens. And privilege perpetuates this way. Now, I wasn't going to call her and say, you're perpetuating privilege. I'm not going to give you any names.
You gave her really good names.
I gave her really good names. But the bottom line is that one of the ways in which privilege perpetuates is through networks. And so the goal of the Health Equity Scholars Program is not just let's train a bunch of really smart young folks to learn public health in a great way. We definitely want to do that. But let's create a network of people who then, after graduation, support each other, who promote each other. So when one of them gets a phone call that says, hey, I need someone to run epidemiology for the state, the names they give come from a different network. So the vision here is, we have 20 health equity scholars graduating every year. In a decade, that's 200. And 20, it's hard to change the world. 200, we're going to fundamentally change the world. So my goal very simply is, I want to change the face of public health leadership in America. And I think Health Equity Scholars is a really important part of that. All right. Can I ask you the last question here?
Yes, you can ask me. I may ask you one too, though.
You can ask me anything. You're the boss. So we're celebrating the 10th anniversary, and some of it has been backward-looking, but also some of it is forward-looking. Let's say you're sitting here in your 22nd year as president of Brown.
Okay.
I'm just, we can wish, right? What do you want to see from the School of Public Health over the next decade? Where do you want to see it grow? And what do you want to see it accomplish in the world?
Oh dear, that's a big question, because in some ways I really believe that it's going to be the faculty, the students, the staff, the deans, the leadership who drive it in the most innovative directions. Qualitatively, what I want to see, quantitatively, if you ask people, what are the top 5 schools of public health in the world? I want Brown to be one of them, right? And I think we can do that. And I know you share that, right?
Absolutely.
So maybe that's the quantitative thing. And I'm not talking about U.S. News and World Report ranking. We don't care about that. We all know that. But I think the agility, the focus on really good science, but then the commitment to making sure that that science gets translated into the lives of people in the city, in the state, in the world. So it's that integration that I think is so important, that I think sometimes gets a little lost. So qualitatively, I want to see great science, great students, really, really high impact in an agile way. Does that make sense?
It makes total sense, and that's what we will strive for.
Okay.
All right. Do you have anything at last?
No, that's fine.
All right. Well, that's a great answer. Chris, President Paxson, thank you so much for all of your leadership. All right. We're nearing the end. 2 more things. So the second video really, I think, captures some of what you heard from President Paxson about the purpose and the real future of the School of Public Health. So let's take a look.
Every time I went to Brown with an idea, it was a very sort of encouraging atmosphere. That's not to say there weren't tugs on my career over these years to go elsewhere, but the fact that I was able to do what I wanted to do at Brown is what kept us here in Providence, and not for 1 minute do I ever regret it.
Brown was the first place where I felt like they appreciated the creative process. I'm a noise researcher. I work with community noise issues. But as soon as I got to my home state of Mississippi, people in the community were like, yeah, we're not really interested in noise. We're more interested in our failing water system, air pollution. So it just kind of made me rethink everything. The dean's office, when I told them my situation, they were like, well, what do you need from us? And so I said, I need the space to be able to be creative about this. And I need the financial support to actually pull it off. And then the following year, the OVPR Seed Award was very instrumental to launch an epidemiological study, the first of its kind in Greater Jackson, Mississippi.
One of the things I was really excited to learn that Brown has is the Health Equity Scholars Program. So if we have each year train a cohort of diverse public health leaders who understand the drivers of inequities and then go forth after they graduate to tackle that in their careers on any kind of public health issue that they care about, whether it be maternal child health or chronic disease or infectious diseases. Health equity is an important lens to look at all of those public health problems that we're working to take off the table.
Because we have these centers of excellence, our students are able to sort of access faculty.
Students are often the drivers of ideas.
They're just ready to work and to make the world better, and it's honestly incredibly inspiring.
As much as I like to think I'm open-minded, I'm definitely not as open-minded as the younger generation because they just come with a different set of experiences. So they're always challenging us to do and be better, which I appreciate.
I am still in contact with many of my students. Many of them are doing some of the similar kind of work. And it is unbelievably gratifying to me to see them at a conference or to see them present their work. And it's just remarkable. It's just the best.
So, the hardest part of putting together this evening, the hardest part, was figuring out which extraordinary faculty to feature. We really have amazing people doing extraordinary work. And yes, you got to hear from Erica Walker and Jennifer Nuzzo and Peter Monti and Vince Moore, but there literally are dozens of people who could have been here in those videos. We decided not to do a video with like 40 faculty because we thought that would actually not be helpful, but it's a reminder of the depth of what those 4 individuals have done and are doing, but also the breadth of what is happening, from making the world more resilient to pandemics, to improving care for people in later stages of their lives, to shifting the way we think about addiction and of alcohol and other substances, to thinking about noise as a pollutant. I mean, Erica Walker, I feel like I learn more from her every day, every time I read one of her articles or I see her, just rethinking what is pollution, how does it shape our sense of daily lives, just extraordinary work. So huge thanks to my colleagues on the faculty. There is champagne being sent around, so I want to just use this as a moment to say thank you again to Chancellor Minkoff and President Paxson, the dynamic duo, really the leaders who have forged a path for this university that has allowed the School of Public Health to grow. So huge thanks to them. Huge thanks to Governor McKee, who has just been a terrific partner from, I think, even the days before he officially became governor, but certainly through now, and really appreciate the commemorative thing. And to thank you to all of you, our community partners, many of whom are here tonight. One of the things that I think is distinctive about the Brown School of Public Health is the way we're deeply engaged in the community. And as I said before, there's no deep engagement in the community unless you have partners. And the partners are everything in terms of getting us to be able to do that. Our faculty, students, and staff, thank you. Everybody hopefully has access to a glass. So I want to just say, please join me in raising a toast to the next 10 years of the Brown School of Public Health and to making the world a healthier place. Cheers. All right, mingle and eat. Henry. Thank you, everybody.